Hello. This document will provide necessary information for lodging facilities that are starting to resume operation of short-term rentals. By having a written policy, you can ensure all aspects of job duties are being completed consistently, as well as assisting with training needs. This could be something as simple as using Buncombe County Health and Human Service lodging guidance and adding it to your existing training program. Make sure employees are being screened as they report in for their shift. Employees can use the self-checker tool. A link will be provided at the end of the presentation. If an employee does not have any symptoms but has been in close contact with an individual that has tested positive for COVID-19, they should be excluded from work and self-quarantine for 14 days from last contact with a confirmed positive individual. Close contact is defined as being less than 6 feet from an individual for greater than 10 minutes. The symptoms that an employee shall report and be screened for are fever, cough, shortness of breath, chills, repeated chills with a shake, muscle pain, sore throat, new loss of taste or smell, and confusion or dizziness. If they have any of these symptoms, they should go home, stay away from others, and contact a health provider. If an employee has been diagnosed with COVID-19, they can return to work if they are able to answer yes to the following 3 questions. 1. Has it been 10 days since you had the first symptom? 2. Has it been at least 3 days since you had a fever without using fever-reducing medication? 3. Has it been at least 3 days since your symptoms have improved, including cough and shortness of breath? Employees can return to work if they have had a negative test result and have felt well for 24 hours, or if provided a note from a doctor stating that they can return back to work without a negative test result or without meeting the above criteria. Buncombe County has developed a screening checklist, and a log will be available via link at the end of the presentation. In addition, some establishments that serve food are required to educate employees on foodborne illnesses. Make sure employees are following reporting policy and not coming to work if showing signs or symptoms of any of the reported illnesses. During the check-in process, inform guests that if at any time during their stay they become symptomatic, to immediately notify the front desk and speak with the manager. Guests who become symptomatic should place a Do Not Disturb sign on their door. Staff should not enter these rooms while they are occupied. Advise any guests or employees who are symptomatic to notify their medical provider, if available, or any local urgent care facility, so that they can be connected with resources within the community. It would be helpful to compile a list of nearby urgent cares, including phone numbers to provide to guests. Also, the guest could use the self-checker as mentioned in the employee health policy. When in doubt, guests can be directed to Buncombe County Health and Human Services website for community testing and additional information as needed. At this time, buffets and customer self-serve areas are not allowed. Dining areas and common space areas are not allowed to be open. Lodging establishments can still provide food, but it needs to be in a prepackaged form or an employee may serve the guest. Drinks may only be dispensed by a customer if the beverage is completely enclosed and a single service is properly protected. Guests can take the food to go and consume it in their rooms. Additional ways to keep employees and other guests safe are: place 6-foot distance markers on the floor for in between guests. Employees who are serving food should not have direct contact with guests. This means ensuring guests can't touch the employees' hands. Food should be placed on a surface for the guest to then retrieve it in order to maintain social distancing guidelines. Also, ensure the proper cleaning and disinfecting of high contact areas.
Hello! Today we are going to show you how to properly clean and disinfect surfaces. For the flow of this video, we are going to show you how to wash hands first before putting on gloves. When washing hands, you want to first wet your hands. This helps to ensure soap will coat all parts of your hands. Once your hands are wet, apply soap. You want to scrub for at least 20 seconds. We say you can sing the happy birthday song or count, whichever is easier. Dry hands before turning off faucet. Then use the disposable towel to turn off the faucet. Dispose of towel. Now that the hands are clean, we can put on gloves. To clean the surface, you first want to read the manufacturer instructions for what type of surface to be used on and also how to apply. Once you have familiarized yourself with the instructions, go ahead and clean the surface. Make sure to wash hands between glove usage and change gloves between the cleaning and disinfectant process. Now that the surface is clean, we can apply our disinfectant. Make sure to check your disinfectant manufacturer instructions for surface type, ventilation, and contact time. Apply your disinfectant and set a timer. Once the timer goes off, you can either air dry or wipe the disinfectant. You are now good to go with a surface that has been cleaned and disinfected as required. Make sure to wash hands after finishing. This video has been brought to you by Buncombe County Health and Human Services Environmental Health Department. For more information, please contact our department at ehrequest@buncombecounty.org or call 828-250-5016.
A disinfectant solution can be made by simply mixing either 5 tablespoons of bleach per gallon of water or 4 teaspoons of bleach per quart of water. In order for this solution to be effective, it must have a minimum contact time of 1 minute for 1,000 parts per million concentration of bleach. So, be exact in your measuring and use your timers. Wear disposable gloves when handling dirty laundry from an ill person and then discard after each use. For reusable gloves, they should be dedicated for cleaning and disinfection of surfaces for COVID-19 and should not be used for other household purposes. Clean hands after gloves are removed. If no gloves are used when handling dirty laundry, be sure to immediately wash hands afterwards. If possible, do not shake dirty laundry. This will minimize the possibility of dispersing the virus through the air. Launder items as appropriate in accordance with the manufacturer's instructions. If possible, launder items using the warmest appropriate water setting for the items and dry items completely. Dirty laundry from an ill person can be washed with other people's items. Clean and disinfect clothes hampers according to guidance above for surfaces. If possible, consider placing a bag liner that is either disposable or can be laundered. Last but not least, hand washing should occur frequently. Employees should clean hands often by washing hands with soap and water for at least 20 seconds. They should do this immediately after removing gloves and after contact with an ill person. If soap and water are not available and hands are not visibly dirty, an alcohol-based hand sanitizer that contains at least 60% alcohol may be used. However, if hands are visibly dirty, always wash hands with soap and water. Employees should follow normal preventative actions while at work and home. Also, encourage employees to avoid touching eyes, nose, or mouth with unwashed hands. Additional times to clean hands include after blowing one's nose, coughing, or sneezing, after using the restroom, before eating or preparing food, after contact with animals or pets, as well as before and after providing routine care for another person who needs assistance, such as a child or the elderly. If you have any further questions, you may contact Buncombe County Department of Health and Human Services Environmental Health via email at ehrequest@buncombecounty.org or by phone at 828-250-5016. For information and real-time updates on the COVID-19 response, please visit buncombecounty.org/BC Ready. This presentation is an overview of guidance from the Department of Environmental Health. Lodging establishments should also review the most current stay-at-home order online to ensure any additional requirements for operation with social distancing. The link to this is listed above.